Assalamu alaikum. Welcome to the second session about medication administration. In this session, we will talk about the medication concept, forms, pharmacokinetics, action, dose response, interactions, and route of administration. Also, we will talk about the factors influencing the routes of administration and the medication errors and strategies to reduce them. We know that medications are available in a variety of forms, and these forms determine the route of administration, and the composition of the medication enhances its absorption and metabolism. Many medications come in several forms, so be certain to use the proper form. هنا بنلقى إنه واضح جدا التأثير بتاع الشكل الصيدلاني على route of administration, the absorption of the medication, and metabolism. So be careful in choosing the suitable form regarding the suitable patient. Medication forms could be caplet, capsule, tablet, or enteric coated tablet. The caplet, shaped like a capsule and coated for easier swallowing. The capsule is a powder, liquid, or oil gelatin shell. The tablet, as we know, is a compressed powder, and the enteric coated tablet is dissolved in the intestine and not in the gastric. So there is a time release. This is the tablets. Those dissolve slowly. The lozenges dissolve in mouth. Elixir mixed with water or alcohol and a sweetener. The syrup is a medication dissolved in a sugar solution. Suspension is drug particles in a liquid medium. When left alone, will settle in the bottle. عشان كده بنلقى إنه most of the suspension and instructions of use بيقولك shake well before use. The lotion is liquid suspension for skin. The ointment is a semi-solid form. The paste is a semi-solid form but thicker than ointment and slower absorbing. Transdermal disc or patch is semi-permeable membrane disc or patch with drug applied to skin. Substitutory is a solid drug mixed with gelatin inserted into body cavity to melt, like to be inserted in the rectum or vagina. When we talk about medication pharmacokinetics, the route is how to enter the medication into the body. Absorption is done from site into blood. Distribution from blood into cells, tissues, or organs. The action of the medication is how medication acts. Metabolism is a change for the medication to be prepared for excretion. And finally, the medication, when excreted, it is exit the body. The previous knowledge is used when selecting the timing, route, risk, and evaluating the response. In this part, we will talk about medication actions. There are several effects of medication. The therapeutic effect of medication is an expected or predictable physiological response that a medication causes. ده الوضع الطبيعي إنه medication should do a therapeutic effect. The side effect is a predictable and often unavoidable secondary effects produced at a usual therapeutic dose. في usual therapeutic dose بيحصل لنا predictable and it is unavoidable effect اللي هي غالبا بتكون عادة بتكون مكتوبة في الليفلت of the medication. Adverse effect is the unintended, undesirable, and often unpredictable severe responses to medication. دي الآثار الغير مقصودة وغير متوقعة ولا يمكن التنبؤ بها للدواء. بتختلف من شخص إلى شخص. The toxic effect is the effect that develop after prolonged intake of a medication or when a medication accumulates in the blood because of impaired metabolism or excretion. And the idiosyncratic reaction is the unpredictable effect. The patient overreacts or underreacts to a medication or has a reaction different from normal. The idiosyncratic effect is largely unpredictable effect, more serious and life-threatening and related to the way the body responds to the medication. It happened in a small proportion of the population. مثال لها the valproate induced liver toxicity. الفرق بينه وبين allergic reaction إنه allergic reaction unpredictable repeated administration. On repeated administration, the patient develops an allergic response to it, its chemical, preservatives, or a metabolite. اللي هو ده بكون happened upon giving the medication. Also it is unpredictable, but it is repeated, not dose related. بتحصل طوالي upon the exposure of the drug. For example, a swelling or a skin rash upon giving medication like for example ampicillin. طيب بعد الدواء ما يتاخد ويخرج جوا الجسم بنلقى انه الدوز دي عندها different type of responses inside the body. The serum half-life is the time for serum medication concentration to be halved. اللي هي medication concentration لما يكون في النص ده يعتبر serum half-life. The onset is the time taken after a medication is administered for it to produce a response. الزمن من ما يتاخد الدواء لغاية ما يبدأ في عمل الأثر العلاجي. دي اسمها onset of action. Peak is the time at which a medication reaches its highest effective concentration. لما الدواء يصل ال highest effective concentration دي بنسميها البيك. The trough is the minimum blood serum concentration before next scheduled dose. الدواء طبعا بيكون عنده schedule of use dose كل 8 ساعات. minimum blood concentration before the next dose دي بنسميها التروف. Duration is the time during which the medication is present in concentration great enough to produce a response. اللي هي الزمن اللي هو بياخده الميديكيشن concentration بيكون great enough to produce a response. The plateau is the blood serum concentration reached and maintained. البلاتو blood serum concentration of the medication is reached and maintained. المرحلة دي بنسميها البلاتو. هنا في الشكل ده بنشوف الدوز ريسبونس كيف إنه كيف البلازما دراج concentration is increased with time لغاية ما تصل مرحلة بيكون فيها concentration ثابت. بنلاحظ برضو الثيرابيوتيك رينج والتوكسيك concentration بيحصل 200 والمينيمم effective concentration برضو واضح بيحصل 200. If we move to the medication interactions occur when one medication modifies the action of another. في medication will modify the action of the other medication. A synergistic effect occurs when the combined effect of two medications is greater than the effect of the medication given separately. يعني بيكون في two medications الأثر العلاجي of the two medication is greater than the effect of the medication given separately. يعني كل واحد فيهم يتاخد براه بنلقى إنه الإفكت بيكون more أو higher لما يكون ال two medications is given in combination. الميديكيشن routes of administration اللي هي عندنا ال oral route, parenteral route, epidural, intrathecal, intraosseous, intraperitoneal, intrapleural, intraarterial. بنلقى أيضا الانهيليشن والانترا ocular وفي التوبيكال route of administration. الأورال بيشمل لنا السبلينجوال and buccal. البرينترال بيشمل الانترامسكولار والانترافينس والانتراديرمال والسبكيوتينيوس. Regarding the factors influencing routes of administration, the oral route is maybe convenience or tolerance. It is easy to give and often produces local or systematic effect. What do we mean by convenience? The medication convenience will affect the adherence, the regimen and use of the medication. If the oral medication is used 3 times per day and other medication is used 1 time per day, I think the one is used 1 time per day is more convenient to the patient. Medication tolerance means that person reaction to a drug is decreased and continue to use. For example, like opioid. The person reaction to a drug is decreased as continue to use. عندنا طبعا برضو في حالات الادكشن. فدي كلها عوامل لازم نكون محيطين بها لما ندي oral medication. The injection, we may have an infection risk. Also, the needle is used once to avoid contamination. Maybe there is a risk of bleeding, but the injection has the benefit of rapid absorption. Skin or topical preparations, it is painless, ما فيها أي ألم. المهم إنها بيكون فيها يعني هو فورم يتمسح على سطح الجلد. لازم نحذر من الابريجنز اللي هي الخدوش. and also the topical preparations provides local effects بالذات في البين relievers اللي بتكون بتتمسح على موضع الألم. Transdermal medications prolonged systemic effect, provide prolonged systemic effect. Mucous membrane medications like pain relievers in mouth problems, the lidocaine solution, they may be sensitive, a mucous membrane may be sensitive, and the taste or smell of the medication may be less pleasant. Inhalations provide rapid effect for local respiratory problems, but it has potential serious side effects like increasing increasing the heart rate. It causes rapid heart rate. So the oral route is easiest and most desirable route, but the food may decrease its therapeutic effect. we should first assess a patient's ability to swallow before giving him an oral medication. في الصورة دي بنشوف البكال and sublingual roots اللي هي sublingual under the tongue, البكال inside the mouth cheek area. The types of oral root. Nasogastric tube we use in liquid form medications. The process is to be dissolved in 15 to 30 ml warm water. Flush tube with 15 to 30 ml of water between medications, and flush afterwards with 30 to 60 ml. If to suction, clamp 30 minutes. دي instructions بتكون مهمة جدا في حال استخدام النيزوغاستريك تيوب. Nasal installations may be self-administrated. Check nerves for irritation, may cause irritation. Nasal backing for bleeding, and certain surgeries may be used and applied by provider. The nasal installation medications. For topical medications, for example, eye installation, as we mentioned in the previous lecture for children, avoid the cornea, avoid the eyelid with the dropper or tubes to decrease the risk of infection. Use only on the affected eye. Never allow a patient to use another patient's eye medications. Elderly patients may have difficulty with drops, and there is a risk of transmitting infection from one eye to the another eye or to the other eye. Do not touch any part of the eye with eye applicator. Apply ointment along lower eyelid drops into the conjunctival sac. Regarding the ear installation, structures are very sensitive to temperature. Use sterile solution. Drainage may indicate eardrum rupture. Never occlude the ear canal. Do not force medication into an occluded ear canal. For skin preparations, it is better to use gloves and applicators. Use sterile technique if the patient has an open wound. Clean skin first, remove tissue and crusting. Apply ointments and pastes evenly. Follow directions for each type of medication. The transdermal patches اللي هي اخوانا ده بنستخدمها لإزالة الألم عادة. The direction is to remove an old patch before applying the new. Document the location of the new patch. Ask about patches during the medication history. Apply a label to the patch if it is difficult to see. مرات لما يعني يتم التصاقها بالجلد بتكون نفس لون الجلد ما بنقدر نفرقها. Document remover of the patch as well. 200 خديناها و200 شلناها برضو it is important. The vaginal installation, use gloves, may need pad to collect any drainage. Rectal installation, also use gloves, may need lubricant, rounded end to ease administration. Place past the internal anal sphincter to prevent expelling, do not force. Inhalation, aerosol spray or powder via inhalers used for respiratory rescue and maintenance. في منها pressurized metered dose inhalers PMDIS والdry powder inhalers DPIS. The pressurized need sufficient hand strength for use. The dry powder inhalers activated by patient breath produce a local effect such as bronchodilation. Some medications create serious systematic side effects زي ما ذكرنا قبل كده اللي هو الانكريز في الهارت ريت. Inhaler spacers used when patient unable to do correctly fill spacers اللي هي بتنفع في حالة elderly patients and children زي ما شايفين في الصورة. Injections. Administering injections. Each injection route differs based on the type of tissue and medication enters. تختلف حسب هناخدها وين وحسب الميديكيشن. Before injecting في حاجات معينة مفروض نعرفها. The volume of medication to administer, the characteristics and viscosity of the medication, the location of anatomical structures underlying the injection site. If a nurse does not administer injections correctly, negative patient outcomes may result. So, administration of injection عاوز اهتمام كبير جدا وفي نقاط مهمة لازم يكون النيرس محيط بها وكذلك الكلينيكال فارماسيست والفيزيشن. The intramuscular injections faster absorption than subcutaneous route. النيدل بتكون thin than half to 1 inch. Amount given of medication in intramuscular route. For adults, it's 2 to 5 ml can be absorbed. For children and older adults and thin patients, up to 2 ml. Small children and older infants, up to 1 ml. Smaller infants is up to 0.5 ml. deltoid site for intramuscular injection واضح هنا في الصورة. Subcutaneous injections. Medication is placed in loose connective tissue under the dermis. Absorption is slower than with intramuscular injection. Administering low molecular weight heparin requires special considerations. For example, a patient's body weight indicates the depth of the subcutaneous layer. في ناس بيكونوا طبعا فات بيكون الفيسيك layer في subcutaneous layer. Choose the needle length and angle of insertion based on the patient weight and estimated amount of subcutaneous tissue. لازم نركز على الانجل of insertion حسب البيشنت weight لأنه بيكون في layers وفي fats وكده. subcutaneous injection هنا دي size of subcutaneous injections والطريقة اللي بتتاخد بها. في الصورة دي في الانجلز of insertion of injection for injections مهمة جدا. بنلقى انه الانترامسكولار injection 90 degrees زاوية قائمة. السبكيوتينيوس 45 degrees. في تاني ممكن تكون عندنا subcutaneous 90 degrees والانتراديرمال 15 degrees only. Intradermal injections used for skin testing like for tuberculosis and allergies. It has a slow absorption from dermis. Skin testing requires the nurse to be able to clearly see the injection site for change. Angle of insertion is 5 to 15 degrees with bevel up. A small bleb will form as you inject. If it does not form, it is likely the medication is in subcutaneous tissue and the result will be invalid. لازم لما ندي الانتراديرمال بتحصل زي سمول بليب. السمول بليب دي بتديك انديكيشن انه الحقنة اتاخدت بالصورة الصحيحة. otherwise معناه الميديكيشن هيكون او result invalid medication. في دي types of syringes لاحظ لها من ال 1 ml 2 ml 5 ml وهكذا. هنا بنلقى الأجزاء بتاعت السيرينج برضو ممكن تعرفوها. measure dose here, avoid touching البلانجر ولا tip of the syringe. parenteral medications دي نماذج منها برضو. In parenteral administration, if two medications are compatible, they can be mixed in one injection if the total dose is within accepted limit, so the patient receives only one injection at a time. في ممكن مرات في parenteral medications يخلطوا two medications لو ما في compatibility بتحصل بيناتهم. mixing medications from a vial and an ampoule. Prepare medication from the vial first. Use the same syringe and filter needle to withdraw medication from the ampoule. Mixing medication from two vials. دي الطريقة المثلى لطريقة الميكسينج of medications. طيب عندنا الانسولين preparations. Insulin is the hormone used to treat diabetes. دي حاجة معروفة بالنسبة لنا. It is administered by injection because the GIT tract breaks down and destroys an oral form of insulin. دي معلومة برضه مهمة وافتكر انها معروفة بالنسبة لكم. Use the correct syringe. 100 unit insulin syringe or an insulin pen to prepare 100 insulin unit. Insulin is classified by rate of action into rapid, short, intermediate, and long-acting insulin. Know the onset, peak, and duration for each of your patient-ordered insulin doses. معظم الاستشارات الخاصة بالإنسولين بتجي للفارماسيست في الكوميونيتي فارماسي، فدي معلومات لازم نكون اتليست محيطين بها. For mixing insulins, patients whose blood glucose levels are well controlled on a mixed insulin dose need to maintain their individual routine when preparing and administering their insulin. Do not mix insulin with any other medication or diluent unless approved by the physician or prescriber. Verify insulin doses with another nurse with the nurse while preparing them if required by agency policy. برضو verification والميكسينج في important point لازم نكون محيطين بها. Example of medication order اللي هي بتكون drug plus dose plus route plus time and frequency. For example, amoxicillin 500 mg capsules PO 6 hourly 4 times a day. The pharmacist's role in medication administration: prepare and distribute medication. Area for stock and dispensing medication is also the responsibility of the pharmacist. The nurse role is to assess a patient's ability to self-administer, determine whether patient should receive administered medication correctly, and closely monitor effects. Do not delegate this task. النيرس مهمتها إنها تكون يعني تعلم العيان أو تتأكد وتقيم طريقة العيان، بالذات مرضى الديابيتس أو السكر اللي هم بيشيلوا جرعات البيت وبياخدوها معظمهم براهم، إنه طريقته صح، وبالتالي بيكون في ثقة في إنه هياخد الانجكشن بصورة proper. Also during medication administration we should take care about medication error. The 7 rights is very important in medication administration. Right patient, right drug, the right dose, the right route, the right time, right documentation after it is given, and right to refuse إنه أنا أخذ الدواء ده بطريقة orally أو parenterally أو هكذا. البيشنت عنده right to refuse، ومفروض بعد ذاك بيكون بيحصل حوار لإقناعه بإنه هو ياخد الدواء بالروت المعين أو بإن استبداله بأذر روت. So the nurse role is to follow the 7 rights, double check calculations, question unusual doses, record after medication given, report errors, near misses, participate in programs designed to reduce error, patient education about medication also. Regarding administration, the nurse can share an important role in it. دي كل المعلومات اللي احنا أخدناها، وأتمنى أنكم تكونوا استوعبتوها فيما يخص الميديكيشن administration. وإن شاء الله يكون في استيعاب تام لها، وشكرا لكم. Thank you very much.